Good morning. For the purposes of the people who can't hear clearly and the people who are joining us later, I'm going to record this session. And at the moment, we have about 15 people here.
I need to get my email.
Okay.
In this session.
Sancy, just probably makes sense if we mute people now.
Yeah.
Yeah.
So when we do the muting, we won't. It would stop the interruptions and the noise, but you can still ask questions by doing the raise your hand button. The raise your hand button is a little circle at the bottom of the screen. Okay. So to mute, I can't remember how. Okay, mute all. Okay, so the mute all is now functioning. So please type your questions here and also raise your hand, and I can turn and raise your hand if any questions. Okay, so are all your practices closed at the moment? Yeah. Okay. So in the hospitals, all our capacity has reduced to urgent emergency care only. Reduced activity throughout. So hundreds of patients per week are getting their appointments cancelled with no timing of when we will see them again. If you are willing to do video consultations and MECS reviews of these patients, please let us know, because we will need you on board to keep people sighted. Yeah? And our aim of this meeting and community today is to keep you safe, because we have already had reports of 2 ENT colleagues, one in ICU and one who has passed away, having had close routine contact with patients. So until we have protective gear, I think we will be asking you to look at your practice to see whether you can offer virtual consults safely. Okay, the exposure time is sort of within minutes. That can put you at risk if you are very close to a symptomatic patient. Yeah? And we know that there are people who are asymptomatic who are carriers as well. So Flo has prepared a very nice questionnaire, which we will go through today. And that's the key thing to get everybody used to. And amongst this group, discuss all the things that you need to do in order to protect yourself. Okay, I'm going to show the COVID questionnaire, which you can find in the section of content. Okay. So if you download the questionnaire, download the file. Yeah. And I will try and open it up for you to see. Yeah. I'm going to show it up onto the screen. Okay, so Pritesh has just shown a message. We're doing telephone triage before seeing patients, taking a history and doing most of the management routinely, remotely. No automated visual fields, no air conditioning, minimal imaging unless it's something that needs required to be sent into hospital. And we have some minimal PPE, water-resistant masks and surgical masks. That is all that we are getting in the hospital clinics. We're getting surgical masks for our clinical examinations, and we're working in pairs and speaking to the patients at a distance. So I'm going to show you the first questionnaire, which is this one. And you can download it yourself under the contents page. Can you see this?
Yeah.
Okay,
Yeah.
so we would be recommending that people ask before you go ahead with any consultation, video or otherwise. And just doing this bit is a big public health intervention because people are worried, they don't have access to health professionals. It takes about 3 hours to get through to NHS 111. About 2 weeks ago, on the 15th of March, I had a heavy fever myself. It lasted a good 2 days, 2.5 days, and I couldn't get it down with paracetamol. And it was quite scary. And 2 of my other colleagues have also had it with patients that are presumably asymptomatic because none of us know we've been in contact with anyone. The symptoms would be very mild. So the first thing to look at is to look at yourself with this questionnaire. Have you had a dry cough? Have you had a fever? Have you had a sore throat? Have you had tiredness and a headache and muscle aches? All of these have all turned out like classic symptoms. After my fever of 2 days, then the cough started and a high fever. And we've also had people in the department telling us that they've been sick with the worst flu they've ever had. It is quite likely that there is a lot of this in the community. So we have to be very careful, almost treating anyone as a potential carrier or potential symptomatic person. So in the hospitals, we're keeping a 2-meter distance for everybody. And I would suggest for all your practices, all your appointments should be by appointment only, 1 every 45 minutes or something like that. You might want to use this period while you're having your shutdown to do a test run with one of your staff. So we've also marked on the floor, at least we've asked the receptionist to mark a 2-meter distance on the floor so that when people come in, the patients know clearly where they stand and they don't come into your space. So most of the history taking would have to be from a distance and ideally done on the telephone after you finish this COVID questionnaire. So this questionnaire is quite self-explanatory. It asks the patients about the symptoms, and then it asks also if somebody in their close family has the same symptoms. And then you enforce the simple rule of the 7 days for the affected person to stay at home and 14 days for a family member that they have to stay at home. Okay, so we ask if they have been self-isolating and why. And in an effort to keep everybody at home, you know, Moorfields A&E is still full. People are going, oh, I don't have to go to work and I'm just going to go and sit in at Moorfields A&E. And that is a big place where people are going to spread the disease. Okay, so what we would like to do is have this questionnaire filled in, and then there will be some guidance for you to go through with them all the different questions to pick up the emergency conditions. Yeah, so let me show. So this questionnaire you can download under the contents page. So that's page 1, and then you have page 2 asking about travel and anybody who has comorbidities, and then we're also asking, is there a reason why you cannot stay at home? So amongst yourselves, you might decide that you will open some of your practices. And I think that would be quite nice to do in a controlled manner. So if you were to receive your referrals from a central location, which can be made possible with Charles's setup with the single point of access, then we can match the people to your level of interest and expertise, for example. If the PPE arrives and it is possible to take macular OCTs, so then the acute macular pathway becomes one that would be very well serving the community. We're trying not to cancel our injections. All our injections are still happening at a reduced capacity and lengthening the time between people. So if you receive your PPE from the CCGs, then we may ask that a visual acuity is taken for the 2 eyes, for you to give the dilating drops to the patient from a distance, maybe on a table, and ask them to put it in their eye so that you minimize the contact that you have with them. And then you can do an Amsler chart, and possibly we can do some of this with one of the links that I put under the contents page, where it's called the Echelon page, and it shows some very basic tumbling ease, some very basic color vision, a small number of plates, and it shows an Amsler chart. So if people have an acute Amsler chart and the patient is known to be diabetic or known to have AMD, and you think that they would benefit from treatment, remembering we're keeping all the 70 to 90-year-olds at home if they have multiple comorbidities. So there's going to be a little bit of common sense to prevail to see if you think this person will be put at extra risk going to a high-risk center, where St. Thomas's we're expecting to have hundreds of patients with COVID on the wards. It shouldn't affect the eye department, but like I said, we have to assume that there will be a lot of people who are carriers. Okay, so fill in the questionnaire and then decide if it's something that you can take place, and then look at your setup to see whether you want to offer these video consultations. I think Charles will release guidelines to say if that will be covered by MECS, and you can do some of this MECS video consultations, and in essence that means opening your practice for MECS. So I think in the next 2 weeks, while we're seeing how quickly the death rate and the hospital admissions go up, it's your time to plan what you want to do, because the government has given some reassurance that they will be covering your staff salaries, etc. So there's quite a lot to think about and quite a lot to set up within your practices. If you have iPads, you may want to put them in a consulting room, and you connect to talk to the patient through the iPad. Yes, Prakash?
There's 34 attendees in a different room.
Yeah.
So either they've joined the wrong room or in the wrong room. I don't understand what's happened.
Okay. Should we run it again a second time?
I think it may be a good idea.
And also this is being recorded, so they should be able to get into this.
One sec.
Okay. So yeah. Let's continue for the people who are.
Sorry to interrupt again.
No problem. Any questions so far?
Everybody's moving into this room now.
Okay, perfect. Okay, so are you clear about doing a questionnaire? Clear about doing the COVID questionnaire? Okay.
Yep.
Yeah. Okay, so I'm going to stop this COVID questionnaire, and I'm going to show you this one, which is the stay-at-home guidance. It's just loading now. Okay, so this is so that you understand and so that you can tell patients as well. So you may find that you make a telephone call and you realize somebody is having a big fever at home. So you want to ask them whether they have somebody who can get them paracetamol, whether they have paracetamol, and the advice is not to give non-steroidal tablets at the moment, or anything non-steroidal, ibuprofen, even if it's a syrup for a child, for example, because there are reports of this escalating the problem that was in Italy, where people were taking paracetamol and non-steroidal and seemed to feel the virus. So if you look at this chart with the stay at home, the first X is the first day the person becomes symptomatic. For example, for me, it was 15th of March. I became symptomatic then, 2 days of fever, lots of fluids, lots of vitamin C, and you know the virus goes through the respiratory tract. It's very important that you don't stay close to anybody who does come into your practice or come into contact with you. And also, if you do get symptomatic and you get all these sore throats, you want to have things like Listerine and anything that's antiseptic to wash the whole respiratory tract, and soap. Simple, very liquid if you can't find any, just lots and lots of soap because it washes off. If you do end up opening your practice and going to work, the first thing you have to do when you get home is have a really big shower. You're going to have to wash everything off, a bit like the pollen season, wash off everything on your body, soak up, lather up everything, and then keep yourself really, really warm. So it took 2 days before my fever burnt out, but that probably was because I have quite a good immune system. And you don't want to take anything with phenylephrine in it, you know, things like the paracetamol with phenylephrine, because it's boosting your heart rate, boosting your pumping, and you can get more sick. All you want to suggest is paracetamol at the time when you start falling sick. Okay? The paracetamol needs to be taken every 6 hours. So you may find that somebody, one of your clients on the video chat tells you, I've got this severe sore throat, I feel a bit unwell, I don't have a thermometer. Okay, so in that case, you still tell them that advice of taking some paracetamol, 2 tablets every 6 hours until they start to feel better, because the paracetamol itself actually soothes the throat and stops people from coughing up all the mucus that then goes down the respiratory tract. If they can do the Listerine and wash everything down the throat, they also put some into the nostril, slightly dilute it, and get it down and completely wash out everything, and ask them to do that once or twice a day with their normal toothbrushing. So the idea is that in the next 2 weeks, everyone who's symptomatic or everyone who's potentially been a carrier gets better at home, leaving only the 5 or 10% that need us in the hospital, where we have closed all our theaters to change them into ITU beds. Okay, so your job is to make sure that people, sometimes just a phone call makes a lot of difference. For example, 3 of us have been sick and we're calling the next person every day. So the next person, so the first person who gets sick within the community, you say, you know, X is unwell, and then Y will call X, and then Z, and then it goes round so that we make sure that people are recovering without needing any shortness of breath and respiratory support. So the person who's affected stays at home for 7 days. Theoretically, you can go back to work on the 8th day, which our VR fellow has gone back to work today. Okay. You will, Dorothy, the session is being recorded, so you should be able to hear it if you come back to it. And anybody in the household, for example, my husband and my 2 children, have to be at home for the full 14 days. Luckily, there's been quite a lot of work we could do, so Joe and I have been doing this work from home, and you want to sort out amongst yourselves this stay-at-home guidance, the 7 days and the 14 days, so it's clear to anybody you speak to. Do not take somebody out of isolation to come even if they have an acute macular problem. You might want to ask the hospital to ring them back, or you might want to record your AMSA significant distortion of vision, send an email to the hospital so that we can contact them, but you don't bring them into practice to do an OCT scan, because that puts you at risk. Yeah? Is everybody clear with that? So the stay-at-home guidance applies to all of you and applies to the people that you speak to.
Get the sound to work at all. I don't know what to do.
Do you want to have a look?
Yeah, please. I can't hear a thing.
Okay. And then we're going to show you some phone numbers. So a lot of the guidance.
Profile.
This is your profile.
No, it's not your real profile. It's on the wrong profile. I don't know why.
Hello, Pritesh. Yeah. Yeah. Okay. We now have about 40 people.
Well, you log off and log back on with
No,
you.
I've done it a million times logged on. I've actually finally
No, on my
done
profile.
too much to do. I'm going to miss half of it.
Okay.
Okay, babe. Sorry.
So
I've stopped using your profile. Actually. There's definitely problems with it.
Settings we are at the bottom.
okay. So we'll continue with patient information.
Speaker volume. Yeah, such a big camera.
So Charles has a question. Charles, Isaac, question. So most of you can still see the chat. A question. Okay, so I think what we would like is for people to get yourself set up in practice so that you can do some of these video consultations and some of the simpler things like blepharitis, dry eyes, and all of that. You know, just giving the sound advice to tell people not to leave the house, unless they're putting it together with an essential shop, and that's when maybe they can go and pick up their dry eye drops from the Sainsbury's if that's what they're going to get their food from. Okay, and wherever possible, we're trying to do everything by video and remote consultations. When we have the facility and the ability to get people into practice, then we may ask for the acute maculars, and we will be releasing a list of conditions that will have a completed pathway, in that if somebody complains and they've got they're diabetic, all the diabetic eye screening services are now down. If they have sudden vitreous hemorrhage type symptoms, big floaters, counting fingers vision, and you're worried that this might be something like the only eye of a diabetic, etc., those things don't wait, in that you can still send us the referral through this email address. Can you see this screen? The GSTT Ophthalmology Medical Secretaries. So that is still taking all your referrals, regardless of whether you have the ERS set up. Okay, there is a question about COVID headaches, and we'll come back to it in a moment. So this email address is being checked daily, and if we get short of staff, it'll probably be checked by consultants. So if you have any concerns, you can refer existing patients that have fallen off the net and perhaps telephoned the practices, and Joe will have a whole list of documents that will set up very clearly the sites threatening stuff that we're continuing to see, things like the retinal detachments, things like the acute age-related macular degeneration in the younger people who are not being forced to isolate, and that will come through with your inbox, and we will also put it under the course content over here. Yes, so we've got started only because I've been at home after recovering in my first week. I started doing some of this. The other hospitals will be coordinating, and Joe will put them all together. Charles, we are recommending video consultations and everyone to do a COVID questionnaire before questionnaire and any assessment. Okay, so, and then going back to the COVID questionnaire of the headache is like the type that comes forward. It's a frontal headache, and it's like your eyes are sunken in, and the patient actually looks quite unwell. So I think if somebody was symptomatic, you would even see it on a video assessment with them. And they would have some of the symptoms present. So typically, of all the ones that the ones of us that think we might have had the COVID symptoms, the headaches have lasted about 3 to 4 days, and the temperature can last for up to 5 days. As long as the person is able to manage and cope with the 37.5, which it sometimes lasts for, then the regular paracetamol, lots of fluids, and somebody to check on them usually gets them out of the woods in about 85% of the patients. Okay, the main thing is the difficulty to breathe. If the difficulty to breathe starts, that's quite significant, and they need to be escalated. And people who are asthmatic, for example, you might want to just reach out to a GP or reach out to the hospital so that somebody can get hold of the patient, because the NHS 111, even when I tried to ring, it was like 3 hours when I had that severe temperature, and they would have said to stay at home to get better. The temperature cutoff is 37.8. Okay, the 37.8 temperature, 37.8 temperature and continuous cough 3 times a day, yeah, are very suggestive. Okay, so those are the symptoms that almost everybody has had. Yeah, and then the headaches and the myalgia is all up here. Okay, and then the thing is to sterilize, 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 lots of supportive care, lots of fluids, and try to make sure people don't get into the whole shortness of breath. There are also 2 phases, the first 3 to 5 days where you get the high temperature, and then at day 7, 8, 9, there again, some people get another temperature or they get some other symptoms. For example, I got diarrhea after that. At about 1 week after the symptoms, I started getting loose stools and a very sore throat, which was not a big feature at the beginning of the illness. So, you know, I think it's something that we should be expecting that will affect people we know. A lot of people that I've spoken to will have somebody at home who is slightly unwell. Okay, so if we can support all of those people to get better in the next coming weeks, that is a huge public health intervention. And then if we can pick up people who are in real trouble, whether, you know, post-ops and not getting their eye drops and doing everything within our ability to keep them going and linking up the advice, that's very helpful. So eye casualty will be open. And we are suggesting that if you do want to be part of this MECS emergency crew in the community, that you link up with Charles and have a central hub, and then people near your location will be asked to telephone you for a video consult, or if we start having the kit, possibly you can open. Is that okay? Are people still with me?
Yep.
Still following?
Yes.
Yep.
Yep. Thank you.
Okay, so that's good. Okay, so we're going to keep the information very, very straightforward. We will give you a list of things to see, to look out for. Okay, so injuries might still happen, traumas and things like that might still happen. I think that we're going to probably see this as an opportunity that if something is going on in the community, you can escalate them to us, and vice versa. If we have somebody who's just a bit frail and had their AMD injection, you know, and we don't want to pull them out into the hospital if they're not needing it for 6 weeks. Maybe we want to push it to 10 weeks. It may be that once we've split up the practices with all the OCTs and you've indicated to us you're all safe and you've got gloves and kit. Exactly. So I think if you don't have PPE, the best thing is not to see anyone. Not to see anyone. Not to see anyone in person. Okay. Video consults and EMSLA charts or acuity charts. Okay, okay, let me just show you a video consult that I did yesterday. Let me do this. This is, so I had a private patient and I didn't see him and I didn't ask him to come in. I did a video consult. Okay, so let me share this. So this is a letter, and I did the cataract surgery before things started to shut down. So distance acuity, I use something called esalon.com, eslaw.com, and it's under your contents page. You will find a link to it. It's very, very crude. It just has a few tumbling E's, but it also has near acuity. And this gentleman, I was doing monovision for him. He's a 44-year-old gentleman. Okay, uncomplicated cataract surgery, and I've given him the advice about the drops and Maxidex and Neverneck, and just made an assessment that he is doing well. Given him some reassurance, asked him to look for distortion with the EMSLA chart for things like cystoid macular edema, and then another phone conversation later on with my secretary, probably make sure that he's okay. It's that sort of thing that we may be doing more of, yeah. And and not the face-to-face stuff unless you have PPE. In terms of PPE, all that we're getting is surgical masks. Yeah. So Pritesh is saying that there are some online visual acuity tests. So let's try and disseminate the information. OpenOptometry.com visual acuity chart. So I think you might want to pair up and buddy up in your local practices so that you can test it on each other to start with, so that you can have your routine of how you're going to do these visual acuity charts and which things that you are going to look out for. The acute macular pathway will stay open. The symptomatic flashes and floaters, high risk, high myopes or pseudophakic retinal detachments. Very often you will have the history, the history would be super suggestive even without seeing the patient. So those are the sort of things. And then the acute squints, like a painful, unable to lift, unable to move, like a third nerve palsy. Some of these emergencies will still show up. It may not show up to you, but we will give you a list from the hospital of the things that we would like you to look out for. So this is going to be more than the usual MECS that you do. But if you are willing, let us know that you are, and we'll make sure that we have enough staff to support you. Okay. So there is one more piece of app that you might want to download, which is called Pando. Okay, so we're going to keep communications open to primary to tertiary care. Telephone numbers and emails will be sent out to you. Okay, you might find there was a COVID person struggling and have made a phone call to you, and that's the way you get them into us. We don't see them in the eye department, but we alert our respiratory colleagues. So in your phone calls, you might help to pick up people that are really in need, okay? So the telephone numbers will be distributed, and then we're also going to disseminate a secure app to download. It's called, so now this app is, it's just like WhatsApp. It's called Pando. Password or Face ID, and then it allows you to take some photographs, okay, that you can then share with the consultants. For example, this is a message about a patient that had an ulcer. Back. The questionnaire is really important. Maybe we will put down there, I consent to clinically important photographs being transmitted for advice if possible. We might leave that as a line. So you can take a photograph of your COVID questionnaire of the patient. And then, for example, this one here is a person with a corneal ulcer. I don't know if you can see. Okay, this was a message for my registrar when I drew out the ulcer, and I wrote my treatment plan, and I messaged it to the patient, to the registrar, who was going to ITU to get this sorted out. So there is this possibility, and we may have 3 or 4 consultants that have this, so that you can contact them if you do come across somebody that needs urgent review, like a chemical injury or endophthalmitis. If someone has had previous glaucoma surgery and suddenly they have a purulent discharge with severe pain, and you're thinking this could be an infectious endophthalmitis and they need to come into A&E, that allows you to share clinical photographs that the patient might send to you. I think the NHS has allowed clinically important information to be shared, but I want you to make sure that your information governance is up to date and you understand the responsibilities when you save patient information all in the secure places and all the right things that you normally do. So don't divert. You can look for me on Pando, and I am on the list. Let me see if I can see Shanaz. So try it out, Shanaz. Possibly because I am under the symptomasis organization. So you'd have to be part of our organization in order to see the symptomasis consultants. Okay, so this is only in the emergency scenario that you think that is the best way to communicate. Most of the time, your normal processes will work. For example, ERS. If it's a patient who is known to the hospital, like somebody who has moderate glaucoma, and let's say they're just normal pressure glaucoma people, and it's difficult to know whether they're progressing or not, then you can still send through ERS the usual advice and guidance pathway. Like this morning, we received a request to fill out a partial sight registration, patient with 6/18 vision and counting fingers in the other eye. You know, so we can go through the notes and do quite a lot of the supportive stuff for the patients, send their blind registrations, etc., as long as your records are available. So if you've already seen before that they've had counting fingers in both eyes and it was advanced diabetic retinopathy or something like that, and they needed something like a blind registration, all of those services are still being supported with our ACLO and things like that. Okay, so set up the organization on Pando, then you should be able to reach us. And then other things, the acute macular pathway, Pando, and the COVID questionnaire. So we thought that these were all the things we need to get you started and let you know. We've recorded this for your colleagues that couldn't join in today, that they might be able to see this sort of half-an-hour chat that we've had. And then if you have more questions, ping them in so that we can put them on the guidance documents that Joe is preparing. We're going to be doing a chart for you of the key symptoms that you want to inquire, and then sort of guide patients to the ones that might need seeing, and get you the available PPE, which will be surgical masks, gloves, possibly the aprons, and there is a set way to take them on and off. Okay, what's really important, I can see, but so Jack cannot hear, so you may have to watch the video separately later. These 40 minutes have been recorded so far. Okay, in terms of the surgical masks, yeah, you want to have them behind your ear if they're the strap ones, or tying it to the crown up here and behind your neck. Okay, usually the surgical masks will come across like this with one ribbon at the top and a second ribbon below. Once you have the mask on, you must not touch your face. In fact, right now, you need to be watching one another and making sure that you're not touching your face. If you have close family at home and stuff like that, at least for us healthcare professionals, we're not even doing kisses or hugs for the children. It's all at a distance. You know, with the masks, there will be YouTube videos that Joe will distribute so that you will know. And what's important is you split it at the top, take it at the bottom, and you never touch the front bit that touches your face. So you kind of take it off like this and straight into the bin. Okay, so there will be some videos on how to put on your masks, take on your masks, and take off your gloves, for example. Yeah, you're going to take them off from the bit that's touching your hand. You're going to lift them, open them on the inside so that the outside bit of the glove is folded in. So you're going to pull it off like this and then go straight into the bin. So those are the things that you can do to prepare your practices, so you know where your clean bins are, where your medical bins are, and if the supplies come, then it may be that a few practices will be the designated diabetic screening places, because we have some very, very good diabetic screeners who will be able to come and help you with the photographs and grade them at the same time. Yeah. So the supply of masks, I have already written to a charity on your behalf, and I've also written to a big drug company. I don't know if it will come, we will just have to take it as it comes. Okay, Yeah, don't put yourself at risk, and we'll just go from there. Okay, good. And then let me see if there's any other content. I want to keep it short so that people don't get too bored if they're going to be watching without audio and then having to watch it all again. Do you want to put all your different questions on here, and then you can say happy to participate or whatever. Yeah, any further questions? Further questions? Joe will disseminate more handouts. Yeah, and in the meantime, get yourself set up for videos.